See, that's exactly why Mark should not do my job. That's the reason. At this time, of course, I'd like to call up David Loud from the Healthcare is a Human Right Coalition in Washington State. He will give us a quick update on the state-based universal health care bill that will be introduced by Legislator Ron Carr later this month. So, David, behind me. All right. Absolutely.
Thank you, Clyde. Brothers and sisters, Healthcare is a Human Right Washington, with which I work, is a broad labor community campaign. I worked in healthcare for 46 years before retiring. Today, I speak on behalf of the 10-year-old 20-state partnership known as the One Payer States Organization, and also speak at the urging of Bay Area Congressman Ro Khanna, who is the author of the State-Based Universal Health Care Act of 2019, which will be introduced in just over a week. I'm here to make an urgent pitch that you recruit your member of Congress this coming week to be an original co-sponsor of the pro-single-payer state-based Universal Health Care Act. This bill will enable individual and multiple states to transition to universal single-payer health care systems and serve as models and set standards for national Medicare for all. Our movement for healthcare justice clearly is on the verge of historic breakthroughs at the state and national levels. Public and congressional support for universal health care and Medicare for all is at an all-time high. And we can make this a winning issue in 2020 and make big advances in 2021. Industry opposition, as we've been hearing, is also at an all-time high and will get more aggressive, pushing back with its Democratic and Republican allies. Meanwhile, Trump's executive order, which we haven't heard about this weekend yet, executive order on Medicare, threatens that program with virtual privatization. At the same time, a number of states are getting politically close to embracing single-payer plans or other methods of achieving universality. Too many to mention, but California, New York, Minnesota, Oregon, Maine, Massachusetts, Washington, and more. And this is the fruit of years of grassroots organizing. My former boss, Seattle Congressman Jim McDermott, introduced the state-based bill in 2015. As a longtime single-payer champion, he had reached the strategic conclusion that we will succeed in winning a universal national plan, but that at least a few states will lead the way. Last year, Seattle Congresswoman Pramila Jayapal reintroduced the state-based bill, and this was her message to her colleagues in the House. I quote, "At the federal level, as we work towards ensuring a Medicare for all type single-payer system, we should also be building on the expertise and energy at the state level. Throughout our nation's history, our states have served as the incubator of democratic ideas and ideals. Let's turn to them to help provide health care for all," end quote. Now, one-payer states and others have been working closely with Congressman Khanna in recent months. And as first vice chair of the Congressional Progressive Caucus and member of the Medicare for All Caucus, he fully supports Medicare for All. And now he's asking for our help to win original co-sponsors for the state-based bill during the next week so that it will build momentum. Now, the state-based bill, quick explanation, would replace the Affordable Care Act's 1332 waiver with a waiver to provide states the necessary federal health care dollars and regulatory authority to achieve universal health care. This waiver, unlike some other waivers you may know about, could only be used to expand access to care. The bill would also allow 2 or more states to create regional plans. And I can tell you on the West Coast, there's been a lot of interest in the idea of building a blue wall from Mexico to Canada. And in the Northeast, there's interest in doing the same thing between and among New England and Mid-Atlantic states. So, We think that this state-based proposal will not be as heavy a political lift in D.C. as Medicare for All, which doesn't mean we abandon it. We fight for them together. And as we fight for Medicare for All, we should not underestimate the ability of the industry and its allies to throw obstacles in our path and require more than one electoral cycle to get where we want to go. So we must also mobilize our support, thank you, for the growing demands on many state governments to create universal access. The state-based bill would enable a few states to demonstrate what universal health care can accomplish, much as the province of Saskatchewan, as we just heard, did in Canada. We believe this two-track strategy will help us build the momentum of our national movement for health justice and will help us win concrete victories along the way. And finally, a word from one state president, Chuck Pinocchio.